Biopsy is a medical procedure that involves taking a small sample of body tissue that can be examined under microscope. Biopsy can be classified into major two groups: the open biopsy and closed biopsy. The open biopsy is additionally divided into two groups. These are incisional biopsy, another one is excisional biopsy. And the closed biopsy is divided into two groups: the fine needle aspiration cytology and true cut needle or trypan biopsy. Advantage of open biopsy: adequate sample can be taken and affected tissue can be removed during biopsy procedure. Disadvantage of open biopsy: it requires operative procedure, spread of infection or tumor tissue. Biopsy incision may jeopardize wide excision. Inaccessible lesion needs wide dissection. Advantage of closed biopsy: require no operative procedure, least chance of spread of infection, least chance of tumor spread. Disadvantage of closed biopsy: tissue sample may not be sufficient, it may not contain referral tissue sample, and chance of neurovascular injury. In case of true cut biopsy, it may require image intensifier. Procedure and precaution. Approach planned carefully with proper imaging. Procedure should be carried out in operation theater with all aseptic precaution and under anesthesia. Incision site should be in the same line if later definite surgery required. Appropriate sized biopsy needle or trypan needle should be selected. For deep-seated lesion, fluoroscopic control is required. Proper knowledge of local anatomy with neurovascular relation. Vascular tumors should be handled with more care, with sometimes more than one set of surgery. Whole tissue should be transferred to a jar containing formalin. Aspirated blood should be allowed to clot and then can be preserved in formalin for paraffin section. Suspected infected material should go into culture tube and sent to laboratory as soon. Crystal containing tissue should not be taken in formalin, stored in saline, or sent immediately. Biopsy is a diagnostic procedure essential for identifying and characterizing various medical conditions. Biopsies play a crucial role in determining the appropriate treatment and prognosis for patients.